So welcome to the Diabetes Preventing the Preventable 2017 Forum. This is our annual scientific meeting where we have endocrinologists, primary care doctors, allied health professionals, scientists and researchers where we can share experience and also expertise in our common effort to innovate and also transform health promotion, disease prevention and also management.
This year, we have attracted over 250 delegates to join our DPP 2017. We have invited experts in the field of diabetes, including United Kingdom, Australia, India and Hong Kong, to share their experience, expertise in diabetes care and prevention and management. I hope you enjoy the meeting. Here are the collections of the short interview from our speakers.
I'm very excited to be here. This is a fantastic opportunity to communicate between basic scientists and clinical practitioners and to share the work that I do, that we do as a scientist, with people who are delivering healthcare to those who suffer from diabetes in Hong Kong and the wider world.
I think DPP 2017 is a fabulous meeting because managing diabetes is really complex and we need doctors from the primary care, from the specialist level, we need nurses, we need dietitians, everybody with the patient to help them get the best outcomes. And this sort of meeting that is so multidisciplinary but also a range of topics is excellent.
This is really a terrific meeting. I have been to some of these meetings before and once again it's really terrific to see all of the different health professionals coming together for a day to learn more about how to improve diabetes management and diabetes outcomes for our patients.
This program has been an excellent program. I have been listening to the lectures from the morning. What I found was this shows a lot of practical aspects of treating diabetes. The content of the programs are useful not only for practicing physicians, but it is also very useful for the paramedics like dietitians, nurses, and also diabetes educators. And the contents of the program can also be easily implemented and will definitely help them to improve their day-to-day practice and interaction with the patients. I congratulate the Asian Diabetes Foundation.
The rates of diabetes in children are increasing, both in type 1 autoimmune type diabetes and in type 2, which is more lifestyle related. And this appears to be happening in many countries around the world. I also spoke about the importance of good control, of good blood glucose control from the start of treatment, and about the higher risk of complications in type 2 than in type 1, even though there's a risk in both. And then I spoke also about the importance of when a young person moves from a pediatric care to the adult care to make sure that that is a smooth and appropriate transition of care. And then finally I spoke about new technologies in closing the loop in terms of insulin secretion and blood glucose levels.
My talk will focus on sharing my experience as a specialist in diabetes care in the hospital. I hope this sharing will encourage the communication between specialists and primary care providers as well as other healthcare providers to improve diabetes care.
In the past decade, behavioral scientists has found out a lot more about factors that can influence behaviors. A lot of marketing professionals, psychologists, are actually using some of these techniques in shaping behavior in the marketplace. And today, I share with the audience a couple of these ideas of how can we use behavioral insights to influence and shape more helpful behaviors.
Today's talk is mainly focusing on dealing with our diabetes patient from a family doctor's point of view. And nowadays we know that diabetes patients need to be cared by various professionals like diabetic specialists, nutritionists, nurses, allied health professionals, and also NGOs. So as a family doctor, we are at the key position to coordinate all the efforts so that our patients can receive the most up-to-standard care. And nowadays we know that patients with multidisciplinary care can enjoy better diabetic outcome than individualized care. So as a doctor today, the main message is to tell our patient they are not alone. They are cared by many, many professionals.
So I talked about the genetics of diabetes and its complications based on many years of experience of research in our local populations. I highlight, the heterogeneity of the phenotypes and also the genotypes, and how by making use of this genetic information and its interactions with some of the modifiable risk factors in order to prevent and also manage diabetes more effectively and on an individualized basis, so as to bring precision medicine to real practice.
So I think one of the new direction in treatment of patients with diabetes is to be able to individualize treatment regimen for our patients, because each person with diabetes are different with respect to their phenotypes, their responses to therapy, and also at different stages of the disease, the treatment would be different.
The next trend in diabetes patient care is how to individualize our management of our patients. We all know that diabetes patients have different characteristic profiles, so we have to tailor-make our treatment management to different individuals. In order to do that, we have to get in multidisciplinary team to cater for each and every patient's their individual needs. So we can look at the patient's profile and give them individual nutritional advice, individual medical advices, individual exercise plans, individual home planning, home monitoring, which are feasible and can be practical to the patients. This is what I think the next trend of diabetes care to our patients.